All right, it is 10 o'clock. Good morning and welcome to the state of South Dakota. My name is Catherine and I'm with the Bureau of Human Resources. Thank you for joining us today to discuss the benefits available to you through the state of South Dakota. As we go through this information, please keep in mind that this is a high-level overview for the sake of time. At the end of the presentation, we will provide you with additional resources to review to make the choices that best fit you and your family. Sorry, you'll notice you're on mute for this presentation. However, at the bottom of the screen, you'll see a Q&A icon. Please use this button to type in any answers, and they will be answered at the end of the benefits portion of the presentation. All right, let's talk about your benefits. Today, I'll be reviewing frequently used terms, talking about account-based plans, including our health savings accounts, flexible spending accounts, and health reimbursement accounts. Additionally, we'll talk about health and prescription coverage, flexible benefits, and life insurance. After we discuss these items, Carrie Singer, our well-being coordinator, will provide you with information on the Benefit Wellbeing Program along with the Employee Assistance Program. All right, to start, the state of South Dakota runs on a fiscal year, so from July 1st through June 30th. This means that our benefits reset on the 1st of July of each year for the purpose of deductibles, out-of-pocket maximums, and eligible services. Coverage effective dates. Coverage always begins the 1st of the month following your date of hire. For example, if you were hired on July 15th, your coverage would be effective on August 1st. The exception to this is our short-term disability benefit, which becomes effective 6 months after your hire date. If you terminate your employment, your benefits will terminate the last day of the month. So if you terminated today, your benefits would run through August 30th. Again, there is an exception to this. If you participate in a flexible spending account, your coverage ends on the termination date due to IRS guidelines and regulations. Now, your new hire enrollment period. For this, you'll receive a system-generated email from our no-reply email address when your enrollment period begins. Once you receive this notification, you'll have 30 days to enroll for your benefits. During this time, you will also receive a daily reminder to complete and submit your elections. Please remember, submitting them is very important. If you miss the deadline, you will default enroll into our Washington High Deductible Health Plan for employee-only coverage, which is a $0 premium. You will not be able to elect any flexible benefits if you default. You will also not be able to add any family members to your health plan or flexible benefits. The only other time you will be able to make benefit changes after your new hire enrollment period would be if you experience a qualified life event or during our next enrollment period, which will occur in May of 2022. Examples of a qualified life event can include marriage, birth of a child, or loss of other coverage, among others. If you experience a qualified life event, you must submit the request to change your benefits within 30 days of the event and include supporting documentation at the time of your request. For example, if you get married on August 15th, you must submit your request no later than September 13th. Changes to benefits due to a qualified life event become effective on the first day of the month following the event. Again, if you got married on August 15th, your new benefit election would become effective September 1st. If you do not plan on enrolling in coverage for health for yourself or your family with the state of South Dakota, you must provide proof of other credible group coverage per our state statute. Please remember that proof of this only applies to you as the employee. You are not required to cover your spouse or eligible dependents. If you do choose to opt out, examples of other group health coverage include coverage under an employee or a spouse's employer plan, TRICARE, or Medicare. Acceptable proof of coverage includes a certificate of credible coverage from your insurance carrier a TRICARE identification card, or a Medicare card. It's important to note here that Medicaid, Indian health coverage, VA coverage, or insurance purchased through the marketplace are not considered credible group coverage. Opting out of coverage. If you fail to opt out during your new hire enrollment period or fail to provide proof of your group coverage within your new hire period, you will still default to the Washington High Deductible Health Plan for employee-only coverage. If you do choose to opt out, though, you can still enroll in other flexible benefits, such as our dental, vision, etc. Some of the frequently used terms you'll experience will include coinsurance, which is your share of the costs of covered health care or prescriptions, usually calculated by a percentage. A second term would be copayment, which is a fixed amount you will pay for your covered healthcare services or prescription benefit. Now we have a deductible. This is the amount you will pay for most covered services before your health plan starts to pay. And finally, we have the out-of-pocket maximum, the most you will pay for your covered services in a plan year. We also have an in-network provider versus an out-of-network provider. So an in-network provider is going to be a provider who has a contract with your health plan or flexible benefit administrators. This will offer benefits at a discounted rate. An out-of-network provider does not have a contract with your health provider or flexible benefit administrator to provide you services. You may be covered at a lesser amount or not at all, depending on the service provided. Next, we're going to go ahead and talk about an HSA, or a health savings account. This is a type of savings account that enables eligible members to enroll in a high deductible health plan to contribute pre-tax dollars to a savings account to help you pay for for eligible medical, prescription, dental, and vision expenses. You can only contribute to an HSA if you are on a high deductible health plan, like our Washington or Lincoln. Contributions can be made to this account from you and your employer, and the money is always yours. It rolls over from year to year. It will also follow you if you leave employment. Now, how do you receive an employer contribution to your HSA? If you were hired between July 1st of 2021 and April 1st of 2022, the state of South Dakota contributes $500 to your health savings account to help offset your expenses for the current fiscal year. Therefore, if you enroll in either our Washington or Lincoln plans, you will receive $500 in your HSA as an employer contribution. However, to earn the $500 contribution for fiscal year 23, which will start July 1st of 2022, you will be required to complete your wellness qualifications, which will be later discussed in this presentation. Now, what is a medical FSA, or medical flexible spending account? This is an employee-only contribution savings account. This allows you, like the HSA, to contribute pre-tax dollars to a savings account to pay for eligible medical, prescription, dental, and vision expenses. It is a use it or lose it style account, however, so you will have through September 14th of the current plan year to incur claims, or if you leave employment, claims incurred while you were actively employed. This can be used in coordination with our low deductible health plans. If you enroll in a high deductible with an HSA, the account will function as a combo FSA until you meet the statutory IRS mandated deductible. And one more FSA for us all here. We have a dependent care FSA, again, a flexible spending account. This is again an employee-only contribution savings account. It allows you to add pre-tax dollars to pay for eligible dependent daycare costs. Again, it is a use it or lose it style account where you will have through September 14th of the current plan year to incur claims, or if you leave employment, claims incurred while you were actively employed. Please note that the IRS maximum contribution is $5,000 per household. Now, what is an HRA, or a health reimbursement account? This is an employer contribution only account. You can be reimbursed for eligible medical, prescription, dental, and vision expenses. And again, it is a use it or lose it account. You will have until June 30th of 2022 to incur any claims, or if you leave employment, again, claims incurred while you were actively employed. How do I receive the employer contribution to an HRA? If you were hired again between July 1st of 2021 and April 1st of 2022, the state of South Dakota contributes $500 to your health reimbursement account to help offset your expenses during the current fiscal year. Therefore, if you enroll in either our Jefferson or Roosevelt health plans, you will receive the $500 in an HRA account. And again, to earn the $500 for fiscal year 2023, again beginning July 1, 2022, you'll be required to complete the wellness qualifications later discussed. Our health and prescription coverage. Wellmark Blue Cross Blue Shield of South Dakota is our new provider as of July 1st. We have 4 plan options offered, 2 high deductibles and 2 low deductibles, well, the equivalent of low deductibles. One is a low and the other is a no deductible. In addition to a comprehensive network of providers, Wellmark administers, the prescription benefit through CVS Caremark and offers a broad array of services and tools to help you navigate your healthcare and provides care management and pregnancy support services. Making our healthcare better. Partnering with Wellmark has been wonderful. There are wonderful benefits to having this, including that they have been serving South Dakotans for 64 years. Now, our enhanced benefits. Wellmark offers these enhanced benefits to our members to help give you better benefits from your healthcare. There's a Be Well 24/7 phone number in case you have any questions. There's the Blue 365, which offers deals towards different resources, such as a gym. And then My Wellmark, which is your online portal. Let's go ahead and delve a little into some of our actual benefit plans. First, we have our Washington Benefit Plan, which is our first high deductible. This is the plan that you would be defaulted to if you did not complete your new hire orientation. The employee but only premium is $0 per month. The deductible for this is $5,500 for an individual and $11,000 for a family. One of the things to note with this plan is that your deductible and out-of-pocket maximum are the same. Next, we have our Lincoln benefits. Our Lincoln benefit plan is also a high deductible plan. With the Lincoln benefit, you have a $3,000 single deductible and a $6,000 family deductible. This plan does have an employee premium based on the value-added benefits. Once you meet your deductible, the plan begins to pay 75% of your costs, and then you're responsible for 25% of costs until you meet your out-of-pocket maximum. Certain generic preventative prescriptions are covered at 100% prior to meeting your deductible. This plan is HSA eligible for those who qualify, and preventative services are covered at 100%. I would also like to note that our Washington plan is HSA compatible as well. The Jefferson plan is a low deductible health plan. This means you'll pay more in monthly premiums, but less in out-of-pocket costs. This plan may be a good option if you prefer being able to estimate your out-of-pocket costs and what they may be in a given plan year. The deductible is $1,750 for single coverage and $3,500 for family coverage. After you've met your deductible, the plan then pays 70% of eligible expenses while you are responsible for 30% until your deductible is met. I apologize, until your out-of-pocket is met. Any copayment amounts, such as for office visits or urgent care, are not subject to the deductible, which means that is a flat dollar amount, and it does apply to your out-of-pocket maximum. Like our other plans, preventative services are covered at 100%, And the Jefferson plan is also compatible to the HRA contribution, as well as being compatible with the medical flexible spending account. Lastly, we have our Roosevelt plan. This plan is robust in that it has no deductible. It has no deductible or coinsurance for that matter, which means that each service is at a set copay amount and the copays do apply towards your out-of-pocket maximum. This plan is ideal if you want to know exactly what healthcare costs will be each plan year. And again, like our other plans, eligible preventative services are covered at 100% with no copayment amount. This plan is eligible to receive the employer health reimbursement account contribution and is also compatible with our medical flexible spending account. All right, so some eligible preventative cares will include immunizations and vaccines, pregnancy care preventative screenings, annual wellness preventative exams, cancer screenings, and what's known as a well child care. Now, sorry. When we talk about copays for primary care providers, we receive the question, does this mean I have to designate a primary care doctor to receive the service at the copayment amount? The answer is no. For purpose of the copays, the PCP for primary care refers to general and family practice, internal medicine, OB/GYN, pediatricians, nurse practitioners, and PAs. Non-primary care practitioners are specialists, such as dermatologists, oncologists, cardiologists, etc., that are not defined as a primary care practitioner. They will have a higher copay for services. Please keep in mind, these plans are still being designed. Oh, my apologies. Let's go ahead and move on to our flexible benefits. The first of our flexible benefits is our Delta Dental of South Dakota. The state currently offers two plans, our base and enhanced dental. They both cover the same services, though at different levels. For example, routine exams. Under the base plan, it's covered at 75%, and under the enhanced, it is covered at 100%. The state subsidizes your premium, regardless of coverage level or plan, at amount of $16.20 per month. It's important to note here that the premiums published in our benefits guide do include this employer cost share. So when you look at those premiums, that's what you would be paying. Next is our vision insurance, which is offered through iMed. Covered services will include exams, frames, lenses, and contact lenses. And again, for the purposes of our flex benefits, these services again reset July 1st of each plan year. We'll touch base here on life insurance. Life insurance through the state is offered through MetLife. If you are benefit eligible, the state automatically provides you with $25,000 life and accidental death and dismemberment. This is a benefit free to you. You have the option, though, to purchase supplemental life at a salary multiple of 1 through 7, up to a maximum of $1 million. During your new hire enrollment, you'll have a guarantee issue of amounts up to 5 times your salary, not to exceed $400,000. For amounts at 6 or 7 times your salary, or in excess of $400,000, you will be required to complete an evidence of insurability. If you increase your supplemental life in any amount after your initial hire period, you will also be subject to evidence of insurability. And finally, if you purchase supplemental life, you may also select to purchase dependent life. Now, MetLife offers several benefits to us, and insurance is just the tip of that iceberg. They also offer short-term disability. This will pay you up to 70% of your weekly salary, not to exceed $1,200 per week if ill or injured, on or off the job, or unable to work for more than 7 days. As we discussed earlier, short-term disability does have a 6-month waiting period after you enroll. And For your notice, short-term disability will coordinate with other payments you receive from the state, such as paid family leave or workers' compensation. MetLife also provides us with our accident and hospital indemnity services. Accident insurance provides you with lump sum payments to help with costs related to a covered injury, such as a broken bone. It does not coordinate with other benefits, and the payments are made directly to you. Hospital indemnity works much the same. It is again a lump sum benefit. However, this is specific to whether or not you've been hospitalized or have associated treatment. And again, it does not coordinate with other benefits, and the payments are made directly to you. Now, the state of South Dakota has a wonderful little tool, and its name is Alex. It's fun, easy to use, and a very interactive online tool that confidentially asks you questions to help you decide which benefits may be best for you and your family. And our additional resources. You can go online to bhr.sd.gov to find our benefits guide. You can also find a doctor, check out Doctor on Demand, review your prescription coverage, even take a look at our plan design matrix, and so much more. Our benefits guide is there to help you figure out what works for you and your family. This is what our screen will look like when you first log on to bhr.sd.gov. We try to keep this updated with as much as we can to help wherever we can. Now, if you select the benefits option, you'll be able to see our dropdown. You can take a look at HSAs, our employee assistance program, new hire employee enrollment information, etc. Now, if you have any questions when completing your enrollment or going forward, you're always welcome to contact our office, either at the number here or at our email at benefits website at state.sd.us. And please note, you can also find our information online on our website. Now, we'll go ahead and answer any questions from the chat.
Okay, Catherine, there is one right now. The question is, what is Doctor on Demand?
That's a great question, and thank you for asking. So Doctor on Demand is a service provided through Wellmark. It'll help you to find a doctor that, again, wouldn't be considered a primary care physician. Kim, do you have any more information on what Doctor on Demand might offer to our employees?
Absolutely. Thanks, Catherine. My name is Kim Buck. I'm the assistant director. And so actually, Doctor on Demand is a virtual doctor visit. So with Doctor on Demand, it allows you to connect with a provider, and they are actually in network. So it gets a little confusing sometimes with all the terminology that we have in the different services. But Doctor on Demand allows you to schedule a virtual doctor's visit with a United States-based doctor for any virtual visits, whether it's for mental health, maybe you have a child that's screaming and crying, or maybe you have a sore throat. It's available 24/7, and it allows you the opportunity to visit with a doctor in moments. You can download an app called Doctor on Demand, and there's actually instructions for that on our website, bhr.sd.gov. Does that answer that question? Looks like it did.
Awesome. Thank you so much, Kim.
Thanks.
Okay, and right now it doesn't look like we have anything additional. So we can move on with the next section, and Catherine, if you're staying on the presentation, someone should happen to have something at the end. We also can answer questions at the end that are from the first half of our presentation.
Awesome. Thank you.
So Carrie, how's it going? Y'all set, ready for us?
Well, it is. I'm doing great. I just had to turn my mute off, so I apologize. I was doing a great intro, but nobody could hear me. Hello, everybody. I hope your state employment is off to a great start. We are glad to have you here with us, and I am Carrie Singer. I am your Employee Wellbeing Coordinator. So for the next half hour or so, I'm going to be talking about all the benefits that are available to support your well-being. So the Benefit Wellbeing Program is designed to help you be well, work well, and live well. We want you to be able to be the best person you can be at work, be the most productive, and enjoy your work, and also be able to provide you resources to stay well and live life to your fullest. So what does supporting your well-being mean? We really want to empower our employees to live healthier, happier lives. And this is in all areas, not just, maybe nutrition and physical activity, which is a lot of times what we think of when we think of wellness, but we want to talk about physical health, but we also want to support your mental well-being, your sense of purpose, financial management, and social connectedness. Those are all areas of your overall well-being that we have resources to support you. So we partner with several agencies in order to provide the best resources to support your well-being. So the three companies or agencies that we work with are WebMD. They provide our well-being portal. ComPsych and Guidance Resources, they provide our employee assistance program. And then the Wellmark Care Team, and this is part of your health plan, and they support any health conditions that you might have, as well as pregnancy support. So these are the three agencies that we work with that work together to provide the best resources for both you and your family. Now, there are lots of well-being opportunities, just some of them listed here on this page. We'll have customized portal experience, so the website that's designed just for you, health assessment, biometric screening, lifestyle health coaching, learning opportunities and challenges, emotional support and counseling, legal and financial guidance and resources. And we do also offer you a reward for participating in some of these well-being programs to make sure most of our employees are taking advantage of them and learning about the opportunities available to them. So all of these different opportunities are provided through the state of South Dakota to all of our employees, and many of them are also available to your families. So how do you find out more about the Benefit Wellbeing Program and all the other resources that we have available? The website, bhr.sd.gov, as you probably already know, is your source for all BHR, Bureau of Human Resources information. To get to the well-being information, you go to the Benefits tab at the top of the page. And then once you get to that Benefits page, you will click on the left side of the page under Benefit, capital FIT, Wellbeing. So that's the Benefit Wellbeing Program. And that's where you will learn about the first of the three programs that I mentioned earlier. So the new Benefit Wellbeing Program is actually brand new for all employees this year. We are currently still in the implementation phase, and it has not been launched yet. So, but you can go to this page to learn everything about the Benefit Wellbeing Program that I will talk about in the next few slides. But just as a reminder, when you need a refresher, you can just follow the steps and go back to this web page. So what is the Benefit Wellbeing Program? Well, we do provide this awesome portal or website, and it's powered by WebMD. And that's kind of where we send everybody for lots of the resources and information. So again, like I mentioned, you'll have a customized portal experience that is based upon how you answer an online health assessment. Now, the Benefit Wellbeing Portal, like a lot of our things that we have in human resources, is confidential. So anything that you answer on your health assessment, it's a 10-minute questionnaire, and anything you answer there is completely confidential. Nobody ever sees your results. We do compile the results as a state, so we know overall for our state employees, what well-being issues might be a highest demand, so then that we can plan our programming appropriately. So the health assessment, like I said, is just a 10-minute questionnaire out on this portal or website. This is also where you can register for a biometric health screening. We provide those throughout the state, and I'll talk more about that later. You can also access at this portal lifestyle health coaching, lots of learning opportunities. There will be individual and team challenges. There's a way to track your daily habits. You can actually connect your fitness device, which can then connect to our different challenges and opportunities to earn rewards. There's lots of tools and resources that are based on your own personal interests. And again, like I said, I'll talk in a little bit here about the reward for participating in this particular program. So the reward for completing well-being qualifications, there are 2 different reward opportunities that we will be rolling out in September. The first of the 2 is a $500 state contribution, and the qualifications to earn this are completing that 10-minute online health assessment, completing your biometric health screening, and there's a couple of options how you can complete that. I'll talk about it in a minute. Both the employee and the covered spouse, if you choose to cover your spouse on the health plan, must complete both of these qualifications for the employee to earn the $500. So both must complete, but only the employee actually earns the dollars. Reward number 2 is where you can earn up to $400 in a state contribution. And the qualifications for this is completing well-being activities that earn you reward dollars. 100 points will earn you $100, and you can complete that up to 4 times to earn a maximum of $400. This award is awarded in $100 increments. So for example, if you were to reach 250 points, you would only receive $200 because it's only given out at the $100 increment marks. So to give you more information about what that reward looks like, the reward payout is based upon the health plan you will select during open enrollment of May of 2022. Because the rewards are based upon the health plan. For example, the low deductible health plan, you can receive reimbursement of up to $900. That's those 2 rewards. One was $500 and the other one was $400. So up to $900 can be received in a health reimbursement account if you're on the low deductible health plan. Those dollars, as Catherine mentioned earlier, can use to offset any healthcare costs you have during the plan year. The high deductible health plan has the option of receiving up to $900 in a health savings account. Again, this is based upon whether you're eligible. There are IRS rules around HSAs, not state of South Dakota rules, but actually IRS rules. So in some cases, you may not be eligible. Your reward will be available in July of 2022. So you can choose now to participate and then earn your reward at that time. So just to summarize again, reward number 1 is a $500 contribution. And this would be HRA or HSA, depending on what health plan you choose in May, which goes into effect in July of 2022. There are 2 wellness qualifications, and I just spoke about both of those, and that both the employee and the spouse must complete. To talk a little bit more detail about that reward, as well as just the overall benefits of participating, when you talk about biometric screening, what's in it for you? We have had a lot of individuals that have participated in our biometric screening, and they have found that their numbers for, say, cholesterol, glucose have been in a higher range. And they wouldn't have known that unless they did the biometric screening. So it is a great way to know your numbers and understand what they really mean. By keeping your numbers in this healthy ranges, you can improve your health and reduce your risk for disease in the future. So these are the different numbers that we gather during a biometric screening. So you have a couple of different biometric screening options. One is to attend one of the on-site screening events that the state provides. We provide these across South Dakota. They will start in October. And if there's one in your area, especially if you live in one of the larger cities or medium-sized towns even, there will be an on-site screening event near you. However, if that is not convenient for you, or if you prefer to just have these screening results taken with your physician, you can also schedule an annual wellness preventive exam. As Catherine mentioned, that's part of our preventive exams that are covered at 100%. You can schedule that exam with your healthcare provider, and you can print off the physician form from the website I showed you earlier, and you can have them fill in those values. You then would submit that form to following the instructions that are listed on the form. There's another vendor that we work with to gather those forms called Total Wellness. Again, all of this screening information, the physician form, that's kept completely confidential. Nobody in the state government sees that. We only compile the aggregate data from the entire state employee population, no individual information. Point that I will point out about the physician form is do not ask your doctor to submit that form. It's best for you to submit that form, and you will receive that email confirmation at the email address that you include on that form. That way it can be confirmed that it has been received. Again, reward number 2, you can earn up to $400 in HRA or HSA. All kinds of activities are available for you to choose from to earn those $400. And I've listed many of them here. Some of them I've already talked about. EAP webinars, that's your employee assistance program, and I'll talk a little bit more about that in a minute. But if you participate in their webinars, you can earn points. BHR Lunch and Learns happen once a month, and we send information out about those in our newsletter. It's also on the homepage of bhr.st.gov website. You can also earn points for working with South Dakota Retirement System, attending their workshops or doing one of the individual consultations. And even though you may not be close to retirement, they can help you budget now and maximize your retirement system. So no matter what age you are or what point you are, it would be great to visit with them. And this is another opportunity to earn points and earn dollars. So it's kind of a double reward for you. Better Choices, Better Health of South Dakota. They have a variety of programs, from walking programs to chronic disease programs, pain management, all different sorts of things that you can participate in. And then the Wellmark Care Team, condition support and pregnancy support as well. You can earn points for condition support. I'll talk more about pregnancy support in a minute. So I'm just back to those points for a minute. Just as a reminder, the portal will be launched in September, and you will be receiving information about that. Some other important rules regarding eligibility: Reward 1 and Reward 2 can be earned independently from each other. So you can do one and not the other if you want to. The employee must be the primary policyholder of the health plan when earning the reward. So if you opt out of the health plan, you would not be eligible for the reward. It is tied to health plan participation. And the other thing, you also need to be enrolled as a primary policy holder when the reward is distributed in July of 2022. So if you opt out during the year you're earning it, or you opt out during the year that the money is given out, you would not be eligible. Now, what are the next steps? Once the portal is live, you will want to create your account on the Benefit Wellbeing portal. Both the employee and the covered spouse must each create individual accounts on the portal. You will just need to accept your privacy policy terms and conditions to access the Wellbeing program and be eligible. The employee is responsible for checking the reward status prior to the deadline, which is April 1st, 2022. The reward status is displayed on the Benefit Wellbeing portal, Whatever you see on April 1st is a reward that you will receive. So it is a responsibility of the employee to make sure what they see is what they expect to be getting. If there's any discrepancy in that, it needs to be resolved prior to April 1st. So again, watch for emails in September regarding the new portal. You'll get an email from BHR Benefits, which is our benefits office sends out emails periodically about important information. You'll also receive an email from WebMD. And we'll also be sending a postcard in the mail. Now let's move on to the Wellmark Care Team, another part of your overall well-being support. So there is opportunities for you to work with a dedicated care manager, an integrated team of specialists such as pharmacy, nurses, and a variety of support. They can help you navigate complex medical systems. They can be your advocate for your healthcare. They can also assist with the assessment, evaluation, and coordination of a treatment plan. So all of the conditions and more on the side are where you could benefit from reaching out to the care team. So any serious illness, traumatic injuries, diabetes, cardiovascular disease, asthma, major surgeries, behavioral health conditions. So there's a lot of opportunities to find out if you're eligible or just to find just basic information to support your current conditions. You can call the 800 number on the back of your Wellmark ID card. Now, supporting healthy pregnancies is also another key part of the programs that we offer. So the pregnancy assessment, WebMD Pregnancy Assist, Count the Kicks apps, Text for Baby, Be Well 24/7. These are all of the different support activities that we have if you or your spouse are pregnant and they're participating on the health plan. So you do need to be participating on the health plan to receive this service. And an additional incentive for participating, if you complete an online assessment in your first trimester, you can receive a $250 wellness incentive. After the baby arrives, you can qualify for another $250 incentive by taking a postpartum assessment. So the cost share for your first and second trimester ultrasound is waived if you enroll in your first trimester. So this is separate from the well-being dollars I mentioned earlier. This is just a totally separate healthy pregnancies support incentive program. And these dollars are contributed to an HRA, a health reimbursement account. That is the only way these are distributed. So if you want to know a little more about that, call Wellmark and they can get you enrolled or get the information for you. Now, your employee assistance program is a very unique program that really looks at any of your challenges that you're having in life, whether they're work-related or life-related. They are there to provide any kind of emotional support, help with work-life balance and solutions. They also have legal guidance, financial resources. They are a 24/7 online support to get you the help that you need when you need it. They also have some great interactive digital tools. So to provide just a little more information, like I mentioned, the confidential emotional support is key for the employee assistance program. They can assist you with anything related to anxiety, depression, stress, grief, loss, just adjusting to life. Perhaps you've just moved into a new area taking this job, or just the stress of starting a new job. They can provide that emotional support. You will call and you will talk to a highly trained clinician. They will listen to your concerns and then they can help forward you or connect you to the resources that are best for you. So perhaps it's work-life solutions and finding childcare, or hiring a mover, or looking for home repair. Any type of opportunity where you are looking for somebody in your area to help you with your to-do list. they can help you find somebody, especially important when you're maybe new to an area and you're not familiar. The legal guidance option is very nice. You can get a free 30-minute consultation for legal guidance. You can talk to attorneys about anything from divorce to wills, developing your trusts, family law. And then if you decide you need more time than that, you can actually get a 25% reduction in fees. Financial resources, when you call in and you just want help with budgeting or retirement or understanding insurance, a lot of insurance information was shared today. That would be another source of information to help you make your choices. You can have unlimited access to a financial expert throughout the year. So please consider just giving them a call and finding out more what they have available. And then, of course, we have online support. So some people prefer just go to a website and tool around and see what's available. Again, they are your 24/7 link to vital information. You can log on to watch articles, podcasts, videos, and slideshows. As I mentioned, there are some webinars that will be available for Wellbeing Point. So it's a good way to get you out there and access those and be rewarded for your time checking out the resources. Interactive digital tools are through a platform called MyStrength. So it's kind of a separate portal, but you can access it through the EAP CompSite Guidance Resources Program. It offers interactive behavioral health tools. You can have guided programs to help you with some anxiety, chronic pain, depression, mindfulness, sleep, a lot of wellness type topics, overall well-being topics. So in addition to the WebMD portal that I mentioned earlier, there's also this guidance resources and then MyStrength digital tool that's also very helpful. So you can access this securely. Again, everything in the Employee Assistance Program or conditions management with Wellmark or the Wellbeing Program is all confidential. So when you first, this program is available right now. You can call them at the 800 number listed on your screen. You can go online to guidanceresources.com. You can also download apps for Guidance Resources Now and MyStrength. There's two separate apps. To get into the program, you just need to register for the first time, and you do need to use an email address. Again, you can use a personal email address, you can use a work email address. Either way, we will not know that you have registered. We will not know what programs you are accessing, whatever is easiest for you. The web and app ID is South Dakota, all lowercase, no spaces. So I'll really encourage you to go check out all the resources that are available there. And I should mention, in regard to the counseling services, not only can you talk to a clinician over the phone with the EAP, they will also, if you need or desire, they can also connect you with a counselor in your area or a virtual counselor. And you can receive up to 5 free counseling sessions through this program based on your needs. And that's something too that is a very valuable resource. So that is an overall look at our benefit well-being program. And we really do hope that you'll access them because we want you to be well, work well, and live well. So if you have any questions, we can answer those now. We can also, I just put the number up here in our website or our email address up here. That will go to our general benefits line. So those are for questions related to the benefits as well as the benefit well-being program. So we'll go ahead and answer any questions now.
So Harry, there is one question currently.
Yep, and I'm just pulling it up, so I've got it.
All righty, great.
Is the bonus money $400 based on completing the screenings and activities, or based on meeting preferred levels of the screen, such as cholesterol numbers under 200 or BMI under 20%. So our wellness program is based upon completion. We do not do it based upon your results. So no matter what your results are, as long as you've completed the health screening and you've answered your health assessment questions, you will receive that $400 reward. And again, I want to emphasize, if you're on the high deductible, the HSA, you might be ineligible for that based on various rules. And we do have those posted out on our benefits website. So it's important to be aware of that. You know, you can then choose the low deductible if you want and get an HRA, or you might just choose to stay on the high deductible health plan and just forfeit the wellness. I'm having trouble finding the app on my phone. Does this work both on Android and iPhone? If you're referring to the My Strength app or the Guidance Resources Now app, it should work on both phones. So I'm not sure why that wouldn't be working. But if you wouldn't mind just sending maybe a message to the email address I listed earlier, that way I could follow up with that directly, or you could email me directly. I'm on the state email system. That might be better. Carrie, Kari, .Senger, SENGER @state.sd.us. And then I'll follow up with you directly to see if there's anything different needing to be done with the Android or iPhone. Question on the previous session: how do we find out where the state vision and dental insurance is accepted? Catherine, do you want to answer that question?
Yeah, I'm happy to. So for Delta Dental of South Dakota and then IMED, they each have their own separate websites. IMED, let me double check, but I believe it is imed.com and then deltadentalsd.com. And you can go online and they each have a, find a doctor kind of thing, where you're able to type in your city or zip code and locate doctors or providers around you.
I will really encourage everybody to check out the bhr.sd.gov webpage and maybe just go visit it periodically. Set yourself a reminder to go check it out. We do update the homepage with kind of the most important information to know at that time of year. That's where you'll find information about enrolling for your health plan next year. When we roll out the benefit wellbeing program in September, when it actually launches, it won't be September 1st, but it'll be sometime in September. And so it's just great to be aware of that website and visit it often. Most of the questions you can find answers to out there, but again, feel free to contact us if you have any additional. Are there any other questions? I don't see any right now. We'll stay on for another few minutes and let you have time to think of more questions if you have some.
So I do see that we got another question with regards to the buying back of years of service and changing your investment amount.
Yes, let me look really quickly to double check that phone number. I do have the phone
This is
number.
for this retirement system, correct?
Yes, it is. So
Okay.
the phone number for South Dakota Retirement, let me double check to make sure that is.
That's half of one at least. So that's
Um,
the supplemental retirement.
Yes. And for buying back years of service, you're going to want to talk to South Dakota Retirement, not supplemental. Their number, just for straight the regular retirement system, is 773-3731 if you're in Pierre, if you're local.
I also added that to the question itself, so that way if anyone wants to write it down, they have a physical copy of it.
Perfect. Great.
So I also just put up on the screen here the website for South Dakota Retirement System. It's sdrs.sd.gov. So if you want to check out individual counseling sessions or any of their workshops, again, we offer well-being points for those. So might be something you want to consider.
And then, just as a reminder, if you have questions outside of this, you're always welcome to give the HR office a call. Our specialists here would be happy to answer any questions that might come up.
Well, I think we're almost to the end here. So thank you everybody for being on the call with us today. I hope that your start with the state of South Dakota employment is going well. And please feel free to reach out to your HR staff or your benefits office or myself at any time. And so we can help make your transition to state government the best as possible.
All right. Thanks again. And everybody have a great rest of your week.
Thank you.